Go.
Hello, today we're going to be showing a sample of the Dynamic Lowenstein Occupational Therapy Cognitive Assessment for Geriatrics. And today we will be administering the visual perception subtest of the main assessment. So we'll go ahead and get started. So in our meeting, I'll ask you questions and also ask you to do things. Some of them are easy and others are more difficult. Please answer or do what you know. If you have difficulties, I will help you. Before we start, I would like you to remove your watch and put it aside until we finish. All right, let's begin. So, Courtney, we're going to be doing the visual perception. So, to start, we're going to be doing object identification. So, I'm going to show you a card, and then I'll just have you tell me what you see, okay? So, what is the name of this object?
Scissors.
Okay. And what is the name of this object?
A chair.
Okay. This object?
Glasses.
Good. Okay, and this object?
A shoe.
Perfect. Good job, Courtney. Okay, so for this one, what I want you to do is let me know what is drawn on the card, or what it can be used for, or what you can do with it. So here's the card.
Apple, banana, and pear.
Awesome. So you were able to identify all of these in one big card. Great job. Okay. And for this last one, we're going to be doing object constancy. So what I want you to do is let me know, what do you see in the picture? So
A phone.
okay.
A spoon.
Okay. That is incorrect. So what I want you to do is point to the small photograph in which you see an item similar to the one that appears in the big picture. So here's the big picture, and point to the one in the small picture that looks similar. Great, yes, that is correct. She pointed to that one. Good. Okay, and then what else do you see in this picture?
A hammer.
Great job, Courtney. Okay, so scoring wise, for object identification, because Courtney was able to identify all of the objects, she would get 4 points, so 4 out of 4 points. For figure ground, because she was able to identify all of the objects in this card, she would score 4 points. And then for object constancy, because she was able to identify all 3 pictures, she would also score 4 points.
Go.
Okay, and so now we're going to assess orientation. So, Courtney, I'm going to ask you some questions and you'll just give me your answer, okay? So, where are you now?
I'm in Louisville.
Okay. What community or city town are you in right now?
I am in Louisville at the Spalding University school.
Okay, great. Where do you live? Tell me the exact address.
I don't remember.
Okay, so do you live in Louisville? Do you live in Illinois, or do you live past E-Town?
I live past E-Town.
Okay, great. And where were you before you came into this room?
Before I came into this room, I was in the classroom.
Okay, so all of these assessed orientation of place, so now we will assess orientation of time. So what day of the week is it today?
Today is Monday.
Okay, what's the month?
It is May
And the year?
2021.
Great, good job. What season of the year is it now?
Is it winter?
Okay, that's a good guess. Is it more spring, summer, or fall?
Spring.
Okay, yes, good job. What time is it now?
It is 2 o'clock.
Okay. And how long is it since you came to the hospital?
It has been 2 weeks.
Okay. All right, great job, Courtney. And so, point-wise, because in the first assessment, so orientation of place, she was able to score 1 point because she answered the questions correctly, but for one of them she needed clarification. And then for orientation of time, same, she was able to answer the questions correctly, but she kind of needed cues for clarification. So she would score 1 point for each orientation of place and orientation of time.